When we think about Alzheimer's disease, we actually define it by two hallmark brain changes. One is the buildup of the beta amyloid, and the other is the buildup of a protein called tau, which accumulates inside the brain cells in something we call tangles. We've seen an emergence of studies that have been targeting the beta amyloid, but there's also new studies that are entering into clinical trials targeting the tau protein. We don't absolutely know that if we target beta amyloid and lower it, are we able to impact memory, thinking, and reasoning. That's still an idea that the scientific community is testing. We also don't know if that's going to be the case for tau. And if you target the tau protein, are you able to impact thinking, memory, and reasoning for the individual? There's really two other ways that the field is going. One is looking beyond beta amyloid and tau and thinking about, for instance, the immune system, thinking about the metabolism pathways of the brain. And we've seen in the last 3 to 4 years really an emergence of clinical trials entering into phase 1 and phase 2, really testing the safety and the tolerability and the dose of potential drugs that are targeting those pathways. And in the last couple years, we've actually seen an increasing in our understanding that this is an incredibly complex disease, and the likelihood that it's going to be one drug, one target is probably more going to be a combination of things, whether it's a combination of drugs or a combination of drug and lifestyle. Think about heart disease. It's a complex disease, and there's not really one shoe fits all, that depending on where you are in the disease progression, depending on the biological changes that you may have, depending on some other aspects, other components of your own medical history, the treatment that your healthcare provider might suggest. It could be lifestyle, it could be medication, it could be a combination of medications with lifestyle, and that's really where the field in Alzheimer's is moving, is this idea of potential combination. How can we put either medication and lifestyle or medication and medication together to best combat this disease?